We're going to begin this hour, though, with a mystery illness. It's overseas. It has health officials very, very concerned. At least 431 cases of this unnamed illnesses are reported in 2 villages in the Democratic Republic of the Congo. What we know so far, 53 patients have died, some of them within the first 48 hours of first showing symptoms. CBS News medical contributor Dr. Celine Gounder is editor-at-large for public health at KFF Health News, and she's with us this morning. We're very glad you're here for this. What is happening here, Celine? What is it?
So we're seeing 2 different outbreaks in Western Congo, very rural part of the country. We don't even know if these 2 outbreaks are related to each other, but what has many public health officials concerned is hearing that some of these kids who died consumed a bat carcass. Bats raise the specter of infections like Ebola, Marburg, also coronaviruses. So that's why there's been a lot of concern. Now, the testing so far for Ebola and infections like that has come back negative, but there have been a number of positive tests for malaria. We're still not sure if this is all just malaria, but that's what all signs are pointing to
But you got me with the bat carcass. Why are they eating bats? I mean, that just sounds so barbaric.
Well, bushmeat is common in
East
Africa.
It is
yes.
common.
And it is a way that it has been a vector for infectious diseases like this.
Yeah, of any animal, the one that freaks me out the most, frankly, is bats, because they carry so many different infectious diseases. And so, that kind of exposure is very scary to us. But you're talking about a part of the world that has very weak health systems, very poor, rural, where sometimes this is what people have to resort to for subsistence.
So Congo is an ocean away from here. How worried should we be here about what's going on there coming?
The importance here is to make sure we figure out what is causing it and that we tamp it down there, that we don't allow whatever this is to spread, because that's when it becomes a concern to the rest of us.
So the president signed an executive order to pull the United States out of the World Health Organization. He also ordered the CDC to cut off communication with the World Health Organization. I think sometimes when people wonder about what's happening, you said it's a world away. Explain how cuts to something like this could affect us here if we don't have resources on the ground, not only there, but also here for our Americans.
Well, we've seen cuts to the CDC and USAID, both of which are agencies that respond on the ground in these kinds of situations. So it's concerning that we've decreased our manpower to respond. I am told that the CDC country director does remain in country in the DRC, but that many of their staff have been pulled because of unrest in the region. So we don't have the normal manpower we would have. The CDC does have the authority to speak in one-on-one conversations with people at WHO in an emerging situation like this. But one of the things that WHO provides is a way for U.S. experts to come into countries, particularly countries that are suspicious of U.S. involvement. When you're part of a multinational team, it really does allow that kind of involvement.
It's scary to hear dying within 48 hours of the symptoms. What are the symptoms, and what is the CDC saying about the outbreak? But what are the symptoms?
Yeah, so symptoms like headache, nausea, vomiting, fever, diarrhea, some bleeding from the nose, as well as with the vomiting and diarrhea. Some of that has been bloody. Again, those are symptoms that make us worried about things like Ebola, but malaria can cause that too. And the other thing, it's not clear if these people are actually dying within 48 hours or they're just coming to the attention of healthcare, really at death's door.
Wow, okay. Dr. Gounder, thank you very much. Appreciate it.